Welcome to Soleo Health, where we help you simplify your complex care. In this video, you will learn how to administer Hemlibra, a Genentech product. This demonstration is a refresher of what you have already learned from your healthcare provider or hemophilia treatment center. Self-administration or caregiver administration should not occur until you have received injection training from your healthcare provider. Please read the Hemlibra package insert for full details on administration and indications for usage. Your Hemlibra medication should be stored in the refrigerator at 36 to 46 degrees Fahrenheit. Remember that your medication should remain in its original carton to protect the vials of medication from light. Do not allow the vials to freeze, and do not shake the vials of medication. Allow your Hemlibra medication to warm up to room temperature prior to administration. This may take about 15 minutes or a few minutes longer. Do not heat up the Hemlibra vials. Wash hands thoroughly using soap and water for at least 20 seconds. Dry with a paper towel. Use your towel to turn off the faucet. Prepare your work surface with an antibacterial wipe. Gather the necessary supplies for the injection and place onto your clean work surface. You may need 2 of some items depending on the dose prescribed by your physician. For a dose that is greater than 2 milliliters, you will need to administer more than 1 subcutaneous injection. We will review this dosing later in the video when discussing combining vials. Here are the supplies needed for injection: adhesive bandage, Hemlibra vials, alcohol wipes, gauze or cotton ball, syringe, 18 gauge transfer needle with 5 micron filter, 25, 26, or 27 gauge injection needle with a safety shield, sharps container for disposal of needle. Be sure to follow your prescriber's instruction for your dose and only use the needles and syringes they have prescribed. At this time, inspect all of your supplies, including the vials of medication and label. If there are damaged supplies, please do not use and contact your Soleo Health pharmacy for advisement on new supplies. Check your medication. To ensure that it is the correct strength or dosage, check the label for expiration date. Check the vials to ensure they are not broken or damaged. View the contents of the vial. Hemlibra is a clear, colorless to slightly yellow fluid. Don't use if it is damaged, looks cloudy, hazy or colored, is missing the cap covering the stopper, or there are particles present. For any questions or concerns, please reach out to your Soleo Health pharmacist for instructions. Let's begin by preparing the Hemlibra vial. First, remove the cap. Clean the vial stopper with an alcohol wipe. Next, you need to connect the transfer needle to the syringe. You will do this by removing the external packaging from the transfer needle and syringe. Push and twist the transfer needle clockwise until it is fully attached to the syringe. Holding the syringe in your hands, you will need to pull back on the plunger to draw air into the syringe. You will want to pull back the plunger to the same amount as your prescribed dose. Uncap the transfer needle by pulling the cap straight off and away from your body. Do not throw the cap away. Place it on your clean work surface. You will need to recap the transfer needle after transferring the medicine. Be careful not to touch the needle with your hands once the cap is removed. Remember that if the transfer needle comes into contact with your hands or any surface when it is not protected by the cap, you will need to remove the transfer needle from the syringe and discard into your sharps container. Replace with a new transfer needle and apply to the syringe as previously described. It is also important to remember that once the medication is drawn into the syringe, the medication is to be administered immediately and not saved for injecting at a later time. With your Hemlibra vial on your clean, flat work surface, insert the transfer needle and syringe straight down into the center of the rubber vial stopper. While keeping the needle inside the vial, you will need to turn the vial upside down. Your needle should now be pointing upwards above the level of the medication, and you can push the air out of the plunger into the vial. Try to avoid injecting the air into the medicine, as this can create bubbles or foam in the medicine. Now we are ready to transfer the medication from the vial to the syringe by slowly pulling the needle tip down into the medication. Slowly pull back on the plunger, using caution not to pull the plunger from the bottom of the syringe. You will want to fill the syringe with more than the amount of Hemlibra for the prescribed dose. Keeping the needle in the vial, check the syringe for air bubbles. Too large of an air bubble can reduce the dose you receive. You will remove the large air bubbles by gently tapping on the syringe until the air bubbles rise to the top of the syringe. Now, you will move the tip of the needle above the medicine and slowly push out the air bubbles by gently applying pressure to the plunger. You may need to repeat this process to remove the air bubbles. Ensure you have enough Hemlibra in the syringe to complete your prescribed dose. Once you have the correct dose, you can remove the needle from the vial of medication. Using one hand, slide the transfer needle onto the cap and scoop upwards to cover the needle. Once the needle is covered, push the cap towards the syringe to fully attach. Lay the syringe on your clean work surface. You may need to use more than one vial to inject your total prescribed dose. If you do, repeat the above steps to draw the medication into a new syringe using a new transfer needle. Always use a new needle to enter a new vial. Once the second syringe of medication is drawn up, it can be placed next to the first syringe, and a second site for injection should be selected and the skin cleansed with alcohol. Remember, the second injection site needs to be at least 1 inch from the first injection site. Never combine Hemlibra vials of different concentrations in one injection to give the prescribed dose. Now we are ready to inject. Pick up your syringe of medication and you will remove the entire transfer needle with cap in place by turning counterclockwise and gently pulling it off the syringe and disposing into the sharps container. Never use the transfer needle to inject the medication into your tissue. You will need to apply a new injection needle as provided by your pharmacy. You will do this by removing the needle from the original packaging and connecting the needle to the syringe using a counterclockwise motion until it is fully attached. At this time, you can select and clean an injection site for the medication to be administered. Appropriate injection sites for subcutaneous administration are the front and middle of your thigh, the abdomen except for a 2-inch section around your belly button, the outer area of the upper arm. You will need a caregiver to administer into these sites on the arm. It is important to remember to rotate injection sites, choosing a new area for injection that is at least 1 inch from the previous injection. Try to avoid injecting into the waistline where pants and belts may irritate the site. You should also avoid injecting into scar tissue or areas of injury or tenderness. For this administration, we will be using the abdomen for the injection of Hemlibra. We will prepare this area of skin on the abdomen by cleansing the site with alcohol and allowing this to dry for about 10 to 15 seconds. You are now ready to remove the needle cap by gently pulling away from the syringe. You can discard the cap. Gently apply pressure to the plunger to get to your prescribed dose. You will now need to locate the area of the abdomen that was cleaned and pinch about a 2-inch area between 2 fingers. Holding the needle at a 45 to 90 degree angle from the area of injection, quickly and firmly fully insert the needle into the tissue. You can release the pinched skin and slowly depress the plunger of the syringe and insert the medication into the tissue. Slowly remove the needle and syringe at the same angle which it entered the skin. Re-engage your safety needle mechanism and dispose needle and syringe into sharps container. All needles are to be disposed after one use and never to be reused. It is not unusual to see a drop of blood at the injection site following medication administration. Using gauze, apply light pressure to the site and apply bandage to cover site. If bruising occurs, you can use an ice pack to cover the site. Important note, never inject into a muscle or vein. Do not save any unused medication for later use. Throw away any unused medication in the vial. It is important to document your injection in your bleed log by noting the date, time, site of injection, and vial information like lot numbers and expiration dates. This information is good to have at your hematology appointments to discuss or review with your provider. Find a method that works best for you to set a reminder for your next injection to keep your injections on track. Always remember to reach out to your Soleo Health pharmacist or nurse for questions about your Hemlibra therapy. Our bleeding disorder clinical team is available at your convenience to help support your journey.